Some symptoms are easy to ignore. A little discomfort, a small pain, something you assume will go away on its own. And many times it does, but not always. Because sometimes your body is not just reacting, it's warning you. And knowing the difference between something minor and something serious can make a huge difference. So in this video, we're going to walk through the symptoms you should never ignore. The ones that mean you should see a doctor as soon as possible. Not to scare you, but to help you recognize when your body is asking for attention. Let's start with one of the most important warning signs, chest pain. Now, not all chest pain is a heart attack, but certain types of chest pain should always be taken seriously. If you feel pressure, tightness, or a squeezing sensation in your chest, that's a red flag, especially if it spreads to your arm, your neck, your jaw, or your back, or if it comes with sweating, nausea, or shortness of breath. These symptoms could indicate a problem with your heart. And when it comes to your heart, time matters. The sooner you get medical attention, the better your chances of preventing serious damage. Now let's talk about breathing, because breathing is something we don't usually think about until it becomes difficult. If you suddenly feel short of breath, or like you can't take a full breath, that's not something to ignore, especially if it happens without a clear reason, or if it comes on quickly. This could be related to your lungs, your heart, or even a blood clot, and all of those require immediate medical evaluation. Now let's move to your brain, because some of the most serious conditions happen suddenly. A severe headache that feels different from anything you've experienced before should never be ignored, especially if it comes on suddenly and intensely. Some people describe it as the worst headache of their life. And when a headache is accompanied by confusion, dizziness, trouble speaking, or changes in vision, it becomes even more concerning. These could be signs of something serious happening in the brain. Now, let's talk about stroke symptoms, because this is one of the most time-sensitive situations. If you notice weakness or numbness on one side of your body, especially in your face, arm, or leg, that is a major warning sign. If your face starts to droop, if you can't lift one arm properly, if your speech becomes slurred or difficult to understand, these are signs of a possible stroke. And with strokes, every minute counts. The faster you get treatment, the better your chances of recovery. Now let's talk about fever. A mild fever is often something your body uses to fight off infections. But a high fever that doesn't go down, or is paired with symptoms like confusion, severe fatigue, or difficulty staying awake, is different. That could indicate a serious infection, and your body may need medical help to fight it. Now, let's talk about pain. Pain is one of the most common symptoms people experience, and also one of the most ignored, because we get used to it. We push through it. We tell ourselves it's not that serious. But pain that is severe, persistent, or getting worse over time is not normal, and it should not be ignored, especially if it interferes with your daily life or if it's paired with other symptoms. Pain is your body's way of signaling that something is wrong, and when that signal becomes stronger, it's asking for attention. Now here's something that many people overlook: sudden or unusual changes in your body. This could be extreme fatigue, a sudden drop in energy, feeling weak without a clear reason, or simply feeling like something is off. These symptoms may seem less dramatic, but they can still be important because you know your body better than anyone else. And when something feels different, it's worth paying attention to. Now let's talk about one of the biggest mistakes people make: waiting. Waiting to see if symptoms go away. Waiting until it becomes unbearable. Waiting until it fits into their schedule. But when it comes to your health, waiting can make things worse. Conditions that could have been treated early can become more serious over time. And early intervention often leads to better outcomes. Now, this doesn't mean you need to panic every time something feels off, but it does mean you need to be aware, and you need to take your symptoms seriously. Now let's bring everything together: chest pain, shortness of breath, severe headaches, weakness or numbness, high fever, persistent or worsening pain, and any sudden or unusual changes in your body. These are not symptoms to ignore. They are signals. Now, here's the most important takeaway. You don't need to diagnose yourself. You don't need to have all the answers. You just need to recognize when something isn't normal and take action. Because getting checked early is always better than waiting too long. So if you experience any of these symptoms, don't ignore them. Don't delay. Get medical help. Because when it comes to your health, it's always better to be safe. And listening to your body is one of the most important things you can do.